So for shade matching, this is something else I want to touch on that's really, really important for my denture patients, because I have so many denture patients where they'll tell me that they don't mind the shade of the teeth. The teeth don't bother them. It's the tissue, because the tissue looks like bubble gum. And so it's really, really important to record the tissue shade. And this is GC's Nature Krill. They've got shade tabs for that. But the problem with, like any company that makes a denture base is those pink shade tabs never quite match, right? And so what I always do is I'll take some GRADIA. Again, this is a pink composite that GC makes. There's different companies like Shofu makes a pink. There's different companies that make pink. I really like this one. And this is the one that I bought also for my technician. And so what I'll do is I'll create these little buttons that I'll try in the patient's mouth. And I can see like, okay, not one of these really, again, matches 100%, but I can see various shades of each one of these colors within the tissue. Then I will create a composite blend of those, a few of those different shades. And then I'll tell my technician, hey, this is like 3 parts of like dark pink to 1 part of like the salmon color to 1 part clear. And then I will send my technician that little composite blend that you see here in the mouth. And again, they've got the same pink composite that I have. So make sure whatever pink composite you're using, make sure your technician has the exact same one. And so now when my denture technician creates that pink, they can make it match exactly as I showed them in the mouth. And there's another step that I want to show you guys here too, because if you guys notice, the teeth have all of these different like colors and things on there. Not the amalgam that's on there. That's actual amalgam that's on there, but some of the stains that are on the teeth, on the occlusal surfaces and at the neck of the tooth. And some of these like old composites that we've kind of made look on there. There's this product that GC makes called OPTIGLAZE Color. Anybody that's seen me speak before, you guys know that this is like a product that I just cannot say enough good things about. GC sells this little kit. It's about, I don't know, $600, something like that. They sent me one years and years ago, and I think I'm still using the same one. I think I only had to replace it because it finally expired. But like once you buy one, I mean, you can use it forever. And I use this thing pretty much every day, but it comes with all of these little bottles of almost food coloring. And the food coloring, it's light curable, and you can just paint it onto the teeth, whether it's a denture tooth or a temporary, anything that's, a plastic or a composite or a bisacryl or PMMA. You can stain that material with this light cured liquid, colored liquid. And it gives you a really, really nice result, whether it's on the pink, whether it's on the white, and it gives you a result that is just really, really outstanding that would be hard to achieve otherwise. And so when you take a look at Julie's definitive prosthesis here, and you take a look from the lateral view, and when we go into the retracted view, right, it's pretty decent, right? Like if you were just looking at these photos without knowing what you were looking at, most people probably would not be like, oh, that's a really crummy looking denture. Most people would be like, oh, she's got some class 5s, that she needs taken care of, maybe a little recurrent decay under that MO and number 12, right? Maybe a little periodontal disease. That's my only regret is I think we went a little intense on the pink. I think we could have made the pink a little less intense. We've given her a little inflammation around some of the canines, but I guess that's natural. Most people actually have that. But in Julie's case, her hygiene is actually fairly decent, on the bottom. So, maybe I could back it off a little bit. But again, if you do something like that, it's easy just to air braid it off and reapply it.